welcome everybody to mine and Imogen's next discussion, which is all going to be about post-cancer treatment and wellness. So we thought we'd do something particular for certain groups of people. So we thought we'd start with those who perhaps have had cancer in the past or have recently just been finishing treatment. And we are talking in particular about kind of post-cancer rather than kind of during treatment. So that is obviously specific to that group of people. Welcome, Imogen. So we're going to kind of talk in two different topic areas really in relation to this, which is Imogen is going to kind of cover the massage side of things and relaxation and why that's important. And then I'm going to be talking a bit more about the exercise side of things, what that might involve, what that might look like depending on perhaps the type of treatment you've had or how that has gone since you've completed treatment. So I'll just start off with talking about obviously kind of general benefits, and then we can kind of work our way from there. So obviously, in general, most people know that exercise does improve how perhaps treatment works, but particularly, as I say, kind of looking at post-cancer treatment, it can help to improve future kind of side effects. It can reduce, obviously, kind of fatigue that you might be feeling post-treatment. In general, like everybody else, it's great for kind of your general fitness levels, cardio fitness, physical ability, and overall strength. The other thing which I really find, I mean, this is again for everybody, but particularly those people who've been through some sort of trauma or treatment, is how getting into exercise, whatever that might be, really can help with people's anxiety and possibly feelings of depression post having treatment for something along these lines, and generally can help to improve quality of life in general, just because obviously when we exercise, we are promoting those kind of feel-good hormones, endorphins and serotonin and things like that, which is really key. And obviously, I mean, I do have plenty of clients who have had cancer treatment. I know some clients who are going through cancer treatment at the moment, and I know how much exercise is really, really helping them. But particularly, as I say, on the anxiety side of things, it helps give them a focus in something else, does make them feel good, and just allows them to really feel good about themselves. It also can give you that time for mindfulness. If you segregate a portion of your day to go and do some form of exercise, whether that's on your own in the gym, at home, outdoors, going for a walk or for a jog around or a cycle ride, or whether it's joining a local kind of exercise class. There are so many benefits in terms of also socializing. So again, if you do go to something that's a group activity, then it gives you the chance to kind of speak to other people possibly about your experience, or just gives you a chance to take your mind off things as well if it's something that you've been thinking about too much, and it gives you that mindfulness time away from home or away from kind of hospital, when you've perhaps been spending a lot of time thinking about treatment. So that is a big plus for a lot of people. And I know a lot of people, even post-treatment, when you're having things like you've got scans, check-in scans later down the line, people get what they might describe as scanxiety, and one of the things that I know that has helped a lot of my clients is having something else to focus on, like some form of exercise, and choosing something that they enjoy doing. What would you say in terms of massage, are going to be the main benefits?
Similar to exercise in some respects, in the sense of, like you say, the promotion of like those endorphins, the serotonin, because touch in general will help with that side of stuff. That we're social creatures. But it will also help more from, like, you can also from the sort of like actual just relaxation. So it is that sort of self-care, that time out away from all the anxieties and stress and worries. It's that sort of just to be able to be in that sort of allotted time, to, like you say, being mindful, to allow sort of that calming element. Both from the sort of mental and emotional side of things. It's obviously quite a safe space, so I often get lots of different clients that open up all about all sorts, and sometimes it is just being able to offload anything like that can actually be quite sort of like relaxing and freeing. But then also from the physical side of stuff with the massage, it can help with the sort of general benefits that you'd get from massage, like for anyone, in terms of relaxing the soft tissue. It can also help improve mood, like you say, with that sort of mood boosting. It can help with quality of sleep. And when
Yeah.
you're sort of going through pain and trying to recover and stuff, sleep is such an important factor for us all, because it's so interlinked with pain and recovery. It's where a lot of that sort of the recovery and repair does happen in the system when we are asleep. So having that sort of improving that quality of sleep can be really beneficial, sort of like once you've been through something sort of traumatic, as you say. And it, like you say, and that will help with overall well-being as well, because you'll just generally have that little bit more energy. So generally, I find this from a massage point of view, they're the sort of general benefits that people would have with this, that anyone that's post cancer or traumatic injury type thing.
Yeah, and you touching upon, I know kind of we're looking at other aspects of our environment and our lifestyle as well. And when you mentioned sleep, I mean, even, someone who hasn't been through something like this, but when we're kind of relating it to, obviously, we talk about anxiety, stress, depression, being kind of overworked, feeling physically like, we can't do exercise because we're just so tired. It is one of those things that we just put on the back burner a little bit, isn't it? We'll kind of try and be good to ourselves in other ways. So you might say, oh, I'll book in a massage, or I will go and do this exercise class. I'll kind of prepare healthy foods, all of those kinds of things to kind of your well-being. But I think really people also still do not have that real understanding of just how restorative getting regular sleep and a decent amount of sleep for what your body needs can have an impact on everything. I often talk about this in relation to not just these kind of groups of people, but if those people who've had children in the past, I've had two babies, and in the past, that lack of sleep is just absolutely horrendous, and you just forget how much of an impact it is. And if you have had children, you've been through that, at the time how detrimental it is to your overall health, how you can get things like brain fog, just your general kind of functioning, both cognitive as well as kind of physical. But then even we kind of forget that. So as our children grow older, we then tend to forget just how detrimental that was. Yet we're still not improving our level of sleep in the way that we, really should do. That's going to benefit our overall health. And I think particularly people post-cancer treatment, I mean, you're going to feel very fatigued at times anyway. And that's not just during the treatment, but it is, for long periods of time post that. So it's, what are the key things that you can do to improve that? And obviously, yes, sleep is a massive one of them. Relaxation and having things that are going to allow you to relax, whether that is going for a massage, or whether as part of that, like you said, it's been able to go and talk to somebody, offload, that kind of thing, that can help with relaxation as well. And then from the exercise point of view, obviously it will improve your sleep, get the more exercise that you do. And obviously the specifics in terms of exercise, the things that you want to be thinking about doing is getting a nice mixture of different types of exercises, things which are going to improve your balance. So obviously different balance exercises, that's going to help also reduce your risk of falls, because one of the things that some people do experience is things like dizziness or lightheadedness kind of when they get up as well. So that sometimes can help with that a little it. Obviously, depending on how difficult your treatment was, you might feel less mobile than you used to be. And so it's about kind of staying as mobile and as independent as possible. You obviously also might have experienced over a very kind of quick period of time muscle loss, loss of strength as well. So obviously getting in some strength building exercises is going to be really important. And obviously some people, depending again on the type of treatment that they've had, may have experienced either weight gain or, on the other side of things, weight loss, and everybody is different. And for some people it is one way, it literally is one way or the other, and they'll experience quite a lot of weight gain or quite a lot of weight loss, or they're really been struggling to maintain their weight. So obviously, if it is kind of weight gain, then you might want to be thinking a bit more about putting some more aerobic training alongside some strength training. If you've been losing weight, then building muscle is helpful with that, as long as obviously you're fueling it correctly and getting enough kind of energy and calories from all the different kind of nutrients you might be getting in the food choices. So obviously, nutrition is a big part of that. And the other thing obviously to think about, which particularly women, particularly menopausal women or postmenopausal women who have been through cancer treatment, will also probably be quite concerned about osteoporosis. So, strength building in particular, when we build more muscle, we increase our bone density. And, you can only kind of improve that situation by doing something like strength training on a regular basis. Obviously, it's very much also linked to hormones. So you want to think about kind of hormonal balance. And the hormonal balance comes from all of those things we've just been mentioning. So, doing exercise, sleep, relaxation, those are all kind of key things. And again, not just for someone who's post-cancer treatment, but particularly women, as I say, once they kind of hit that menopausal age, that's key to start trying to balance out those hormones as much as possible when they're going to be fluctuating throughout that period of time. So yeah, I think those are all kind of really, it's interesting how so many of those are just interlinked. We think of them as very kind of separate kind of categories of wellness, and some people will focus on one thing more than another, but I think it's really important to try to get a good balance. And it does take time, I think, doesn't it, to kind of put all those things together and think, all right, I need to be doing this, I need to be doing that, but actually just small little changes over time are important. And actually coming to people like yourself and me for whether it's for a sports massage or a massage treatment of some kind, whether it's for relaxation, whether it's for kind of exercise or nutrition, just getting kind of some really kind of specific advice for you as a person is important, isn't it?
Because like you say, it's a bit like, I mean, the same with the massage, like you can approach the different sessions depending on almost essentially what stage or where you are in wanting to do that recovery, whether it is like actually you are just really fatigued from it, or whether it be emotionally, whether it be physically or mentally. Like then you can have the sessions that are tailored and the techniques and things that are tailored more to that de-stress, relaxation and promoting that side, which then obviously then will probably focus more on things like improving sleep, and incorporating of just little bits of movement and exercise into to match sort of energy demands. Whereas it may be then, like you said, where you're sort of focusing with the exercise in terms of building strength or mobility, then you may find that the massage sessions are more appropriate to looking and sort of evaluating where you're at, or where you're at, what's the area that does need sort of attention, and maybe it will incorporate some more stretching based techniques and things like that, rather than the sort of relaxation side of stuff. Or like you say, it may be that you're actually still just left with the residual side effects, so actually maybe it is just almost like a mopping up type thing of trying to help calm down anything that may be left with, whether, like I say, it could be the headaches, could be any other side effects and things like this, so techniques to help with those types of conditions and stuff. So but it is very specific to the individual and where they're at. And it may be even, I suppose, also in the fact that it might not be linear. So it may be that you start off one area, you get on and you're raring to go, and then actually it almost feels like you're going backwards because actually you're tired and things are catching up, almost of like now you're in a space to be able to actually process what's happened. rather than actually coming out and expecting to feel really like bleh on the floor and build up from there. It might be the other way around for people. That's not uncommon.
No, I totally agree with that. And again, that has been my experience with some of my kind of post-op cancer clients because, you know, they feel really, sometimes they can feel really strong during treatment because they're really kind of, again, they're focusing on their nutrition, you know, they're trying to stay really positive, they are getting more sleep, they're really focusing on that. But then kind of, you know, whether it's, you know, post treatment or even a little bit later down the line, it really is about having to adjust to a new way of life in lots of respects. Like you say, it's not just going to be a linear kind of journey for some people. You know, there will be ups, there will be downs, and one week they'll be feeling great, and then the next week they'll be thinking, "Wow, I just feel like I've just been hit by a, you know, hit by a lorry because I just am
Mm.
exhausted, and I just, you know, I'm not sure how to deal with this. I thought that my change in my nutrition, more sleep." You know, this type of exercise was working really well for me, but now I feel like, you know, I'm just having a really kind of negative week. So, you know, it's about, you know, yes, finding the things which work for you at the time, but also being open to adaptation and just remembering that, you know, it is going to be a bit of a longer journey. No matter how good we feel in one week, it doesn't guarantee that that's going to be the same the next week. And so I do think that, you know, getting a bit more personalized advice from people who've had, you know, either that experience or, like, you know, myself working with clients who um, do experience all sorts of different post-op, post-treatment symptoms, what they should do in terms of their nutrition, you know, what to worry about, what not to worry about, just getting a little bit of personal
Mm.
advice. There are so many you know, websites out there. Obviously, you've got your NHS website, you've got lots of different cancer related websites, you know, charities that offer brilliant advice on their websites. But obviously, you know, again, that is going to be, you know, generic, as much as, you know, they probably like to personalize. And I know sometimes, depending on where you've been having your treatment, the quality of care is always going to be good. And they're always, I know that the response I've had from some of my clients has always been that they've been caring, they've been brilliant when they've gone in for their treatment. But sometimes I know that the post treatment advice can be limited, you know, and they don't necessarily get the support from a nutritionist or, you know, someone who's experienced with working someone with someone that is kind of exercise for kind of cancer treatment and post treatment and what they should do, you know, because everybody is just so unique in their response to these things. And obviously, that is also something we have to bear in mind. You know, all of the advice, even that we give as people experienced, obviously, again, myself with kind of clinical experience with those post treatment, it is just also very individual based on what kind of treatment they had, what advice they've had, whether they have had an op or not, what is their current lifestyle like, you know, and again, analysing all those things we talked about, the sleep, the stress levels, you know, what else do they have to contend with in their life, that's going to kind of make their plan of action just slightly different to the next person. And all of those things are really important to consider. But sometimes it just takes one or two sessions with a professional who's had that experience, and like you as well, you know, being able to offer advice to people when they come in, and someone just to talk to and to clarify things with. It can make all the difference to that one person, just to get their head a bit more straight and just to kind of, again, allow them that time to process things and to put a plan of action in place based on their individual needs.
Yeah, it's that sort of gives them steps, isn't it? It gives a to-do list
It does.
almost.
It does. And we all need to-do lists, don't we?
I live by lists.
We all love a to-do list. We love a plan, because then we just feel like we just know what we're doing. We don't feel like we're just kind of, you know, going from one day to the next, not knowing what the next stage of our journey is.
It
Um,
gives the direction, doesn't it? And the motivation to and the understanding of why you're doing what you're doing rather than just going through the motions.
exactly. So I think it is important for people not to feel like, once they've finished a treatment and they're not got that access to the nurses, or to their consultant, to feel a bit lost, really. And I think it is
Mm.
important sometimes for some people to reach out just for that a little bit of extended support, just so that they feel that A, they know what they're doing, and B, that they're being listened to, they're being heard, because there's probably so much that's still kind of going around in their head, and concerns, and like we said, anxiety can be quite a big kind of post treatment response. So it's important to try not to allow that to fester as much as possible, and definitely come and speak to someone with the experience that they need.
Yeah, for sure.
Okay. Well, this was a nice one to do for that particular group. I hope those people who have been affected by cancer, whether it's for themselves or a family member or a friend, have taken something away from this. But as per usual, Imogen and I are always available for you to contact, whether it's through actual appointments or to email, post these videos that go out if you've got any kind of further questions. We'd definitely be kind of happy to answer them. And maybe one day we should try to set up some sort of live Q&A. Might be a nice little
That'd be
assessment for
fun.
people. Once we've sent a few more of these videos out, we'll give a few people some food for thought, and get a few questions, and maybe it will inspire us to do a bit of a live Q&A one day.
Yeah, sounds good.
Okay, good. Right. Thank you for joining us, everyone. We look forward to speaking to you again soon.